With so much vaccine coronavirus news breaking late today, we asked SUNY Upstate Global Health Director Dr. Stephen Thomas to join us again tonight.
He's joining us live. Thanks for fitting us in, Dr. Thomas. Really appreciate it. I know it's a busy day.
Yeah, of course.
Let's first talk about the FDA advisory panel not giving its blessing to the Pfizer plan for booster shots for all Americans, but it did approve the extra shots for those who are 65 or older and run a high risk of severe disease. Not a surprise to you, and if not, explain why not.
Yeah, not really a surprise because, again, we make vaccines to try to impact public health problems. And the problem that we're seeing in people who have been vaccinated and have a breakthrough is primarily in people who are over 65 years of age, people who have other medical problems like cardiovascular disease or diabetes or kidney disease, right? Those are the people that are ending up in the hospital, ending up with severe COVID, and unfortunately dying from COVID. So when you do the risk-benefit analysis of a third dose and the risks that come with that, as minor as they may be, and you put that in the context of what kind of benefit are you going to get from a third dose, that is really the population where that equation, it makes sense to offer a third booster dose to those people.
But Dr. Thomas, I think that might be the scientific answer. But I think a lot of people are angry. They had been told, boosters would likely be coming. They might be confused, scared right now. I mean, what would you tell them?
Yeah, so what I would tell them is that data from around the world, including in Israel, is that in people who do not have immunosuppressive conditions or who do not have some of these pre-existing medical conditions, 2 doses are going to protect you. And they're going to keep you out of the hospital, they're going to keep you out of the ICU, they're going to keep you off the ventilator, and they're going to protect you. That's the first thing I would say. The second thing I would say is that this is not the end, right? So all these developers are doing big booster studies. So Pfizer, for example, has a 10,000-person booster study that's going on right now that they started in July. And this is really what the FDA panel was asking for. They were asking for more data in those other groups of people. And that data is going to be made available, probably before the end of the calendar year, if not the beginning of the next calendar year. And then they'll revisit the issue.
And I think people are concerned, too, because we're still hearing about the breakthrough cases. So people are under the assumption, well, I'm going to get that booster shot. I'm going to be all set.
Yeah, I think we really need to be clear on something. The Delta variant is running rampant, not because we're not giving booster doses to people. It is because we still have 40% of the country that's not vaccinated. That includes people who cannot be vaccinated, so the kids under 12. But it also includes a lot of people who are making the decision to not be vaccinated. So when we talk about being, concerned about what's going on with COVID in the country right now, concerned about what's going on with COVID in central New York and where, we live, it is not a booster dose issue. It is the fact that we still have a huge gap in people getting their primary immunization series.
So let me ask you this question then. Good answer there, as usual, from you. Onondaga County reports its highest case day since late January, 271 today. There's 1,000 active cases. You've got almost 100 in the hospital, 20 in the ICU. How much does that concern you?
It concerns me a lot, right? Because, again, the public health burden of COVID is human suffering, so those people who have severe and critical illness, even people who have mild disease, I don't want to forget them. Even people who don't have to be admitted to the hospital, they can have long hauler syndrome, which can be incredibly debilitating. But in terms of like the near target, it's people who end up having to go into the hospital and the stress that places on the hospital. So if you really want to look at, cases up, cases down, what do the numbers look like, what does the percent positivity looks like, for me as a clinician, the rubber hits the road when you go to the hospital and you have a full emergency department, or you have a 13-hour wait, or you don't have any beds, or you don't have any staff. That's where the real problems come into play. So those numbers are not good.
Right, and the latest numbers show 20 patients are in the ICU, and almost all, 90%, are unvaccinated. So I think that speaks volumes, right?
Yeah, it is. We are. The story that we're seeing play out right now in central New York is the same story that we're seeing across the country, right? In states that have low vaccination rates, the intensive care units are full, the hospitals are full, and importantly, and we heard about it on the previous segment, children who cannot be vaccinated, the rates of kids getting infected with COVID and ending up in the hospital is much higher in states that have low vaccination rates versus those that don't. And I agree with Dr. Fauci. The best thing we can do for kids who can't be vaccinated is surround them with vaccinated adults.
I think that says it all right there. Dr. Thomas, thank you so much. I know you've had a busy day. There's a lot going on, but we really appreciate you fitting us into your schedule. Thanks so much.
Thank you,
Absolutely.
Dr. Thomas.
Yeah, thank you.